Hi everyone, my name is Vivian and this is my presentation on healthcare reform. So the outline is universal insurance coverage, improve the quality and population health status, and finally decrease the inflation rate for the healthcare spending. So my first recommendation for the universal insurance coverage is automatic coverage while retaining current policies. My second recommendation is Medicare for all. So the first one, automatic coverage while retaining current policies. Policies based on this model will retain the most key features of the current system. Specifically, unemployment-based coverage would continue to play a large role. Income-based subsidized coverage would still be available through existing health insurance marketplaces. And eligibility criteria for Medicaid and Children's Health Insurance Program, CHIP, would be preserved. People who do not qualify for Medicaid or CHIP would be automatically covered. And for people who are ineligible for Medicaid and CHIP and are not enrolled in any other source of coverage, default coverage would be provided. Moving on to the challenges, the employer firewall will be terminated to provide subsidized default coverage for nearly everyone. And altogether, employers would probably have a fewer incentives to offer coverage. Once the employer firewall is eliminated, the number of employers that change their offerings would depend on the generosity of the premium subsidies available to their workers. The strengths of this policy is that it's based on an approach that could further reduce out-of-pocket premiums and encourage active enrollment in coverage from other sources by increasing the generosity of premium subsidies from other income groups. Moving on to the next recommendation is Medicare for all. So currently, Medicare benefits kick in at age 65, and the plan for this policy is to lower it at age 0. And our national health insurance system will still exist. Medicare would also reduce the amount of patients must pay out of pocket. Now, the challenges of the Medicare for all is that if the systems were to expand to Americans of all ages, then it could benefit for everyone. But this reduction might not be total because providers might not be able to afford this offering for Medicare for all level prices to all patients. And a lot of Americans fear that the tax increase would be too much. And a lot of Republicans, conservatives are fearful of the tax increase. And the strengths of this policy is Medicare for all could reduce the total healthcare spending in the US by nearly 10%, and that results in $5 trillion in savings. Studies have shown that the US could save up to $500 billion annually in billing and administrative costs by moving to Medicare for all. That money could be used greatly to expand primary care in this country and make certain that all Americans can get health care that they need and when they need it. Also saving billions on expensive emergency room care and hospital visits. The Medicare for All system not only benefits the individuals and families, it also benefits the businesses and community. Small and medium-sized businesses would be free to focus their core business goals instead of wasting precious time and energy on navigating an incredibly complex system to provide health insurances to their employees. My recommendations for improving quality and health population status is increasing fruit and vegetable intake and preventing suicides. So currently, only 1 in 10 adults in the US eat the recommended amount of fruits or vegetables. These policy levers include spending on specific programs, direct regulation of businesses, altering the built environment, and altering the socioeconomic environment while changing the informational environment and deregulation when laws act as a barrier to health. And what we can, as a policy, we can set new nutrition standards for schools. We can set a nutrition standard for schools, for school food, by banning sodas, sugary drinks, and fried food, chips, like junk food. And we would also provide grants to schools to buy like personnel to create healthier food options in the cafeteria. This is that the factors affect where the dietary patterns, including fruit and vegetable intake, and the availability of the foods depends on where people live, work, study, and community resources such as public transit, sidewalks, or access to grocery stores, and the social and political economic factors that shape overall food and that shape the overall food environment. The strengths of this policy is while increasing more vegetable and fruit intake, it can reduce risk of heart disease, high blood pressure, and various illnesses. And all these fruits and vegetables, they contain vitamins, minerals, and other nutrients to help prevent heart disease and cancer and other illnesses. And some of these nutrients include fiber, potassium, folate, vitamin A, and C. My next recommendation is preventing suicide. The healthcare system intersects with all aspects of suicide prevention, suicide attempts, and fatalities. And the 45% of people who do die from suicide, they visit their primary care physician within a month before their death. And the suicide prevention interventions aim to improve the public's knowledge of the risk factors for suicide. And state laws and policies focused on training teachers and school admins include mandated annual training and policies and programs for suicide prevention, intervention, and post-intervention. The safer suicide care through our systems will need to change, and we would also need to reduce the access to lethal means among people at risk of suicide. Challenges. So some healthcare professionals argue not enough money is being allocated toward answering the question of how to prevent suicides, and that too much is spent on widespread public awareness campaigns, which are less effective than more direct outreach. And the at-risk individuals, including with mental illnesses and direct relatives of people who have died by suicide. The strengths of this and it's an example of changing the factor to help prevent suicides. And there was a study that showed it did work, and the nets installed did decrease the number of suicides by people being able to jump off the bridge. So next up, we have decrease the inflation rate for healthcare spending. And my first recommendation is limiting out-of-network payments to hospitals. And the second one is promote transparency on price and cost sharing. Limiting out-of-network payments. Placing limits on what hospitals can collect for out-of-network care could yield savings similar to the Medicare for All, or setting a global spending cap. And under these strict proposals, such as limiting out-of-network charges to 125%, Medicare would save estimated $108 billion to $124 billion annually. The challenges is while cost containment can benefit patients, the hospitals would have disrupted revenues. And a policy that reduces revenue so much that hospitals could close or the quality of care is disrupted and would not be in the best interest of the patients. These strengths. The strictest out-of-network payment limit is considered 125% of the Medicare payments, and it would yield an annual reduction of $108 billion to $124 billion. Annual reduction of $800 billion to $124 billion in nationwide hospital spending. Next up, we have transparency on cost sharing and price. Establishing standards for insurers to provide dollar estimates of the total cost paid by insurer and cost sharing to patients is covered items and services at the most crucial points of decisions. Consumers are expected to make decisions based on affordability and quality, which will drive competition among providers and ultimately lower healthcare spending. The challenges of this is that states must pass legislation that mandates increased price sharing across providers, hospital networks, physicians, and consumers. Increased price transparency combined with the reference pricing, the price consumers can expect to pay for services that has shown to put pressure on providers to lower their prices. The strengths of this could help prevent patients struggling with medical debt to be out of debt or to prevent debt. Having a clear understanding of what the cost of a specific treatment is and their share of the cost will be avoided, and there won't be any billing surprises for the patient. It also puts them more in control of making more financially suitable healthcare decisions. That is it for my presentation. Thank you everyone for staying and watching, and have a great day.